Welcome to the Southern Regional Testing Agency's Dental Hygiene Non-Patient-Based Examination presentation. My name is Jennifer Lamb, and I have been a dental hygienist for 19 years. I currently practice in a clinical setting in Little Rock, Arkansas, and have been a SRTA examiner for 9 years. Today, I'd like to discuss with you SRTA's Dental Hygiene Non-Patient Examination and the agency's transition to a complete Manikin-based exam. Information given in this presentation is specific to SRTA and may be different from other testing agencies. During this presentation, we will review a brief overview of SRTA, the history of our non-patient-based exam, and details of SRTA's hygiene exam. We will overview what you can expect on exam day and end with some frequently asked questions. SRTA was established in 1975, and our goal is to ensure candidates are well prepared for the evolving practice of dentistry. We are committed to our candidates' short and long-term success, and we seek to provide a positive and collaborative environment in our assessments. SRTA exams are accepted in 70% of the United States today. In addition to SRTA's already high acceptance rate, it may be helpful to know that once a candidate obtains an initial state license and practices at least 5 years, most states will allow licensure application through your credentials. This means you would not have to retake another clinical examination for licensure. It is important to note that each state board has different regulations and requirements. We advise you to contact the individual state board for specific details regarding your licensure and professional path. The role of a testing agency is to properly assess a candidate's knowledge and skills and determine whether they are adequately prepared for the dental profession. Today, we are going to discuss more about SRTA's new Manikin-based hygiene exam. For a bit of history, the use of live patients in dental assessments has been a widely debated topic for several years based on considering patient care and patient and student safety. The World Health Organization defines patient safety as the absence of preventable harm during the process of healthcare. Over the life of the debate, the industry has come to more fully realize that the testing of live patients has the potential to run counter to patient safety. In fact, few other professions today require live patient exams for licensure. Through this debate and process, the dental industry has found justifiable alternatives to live patients through technical, highly developed, and valid models. Stakeholder organizations such as the American Dental Association, the American Student Dental Association, and the American Dental Education Association have endorsed the discontinuation of live patient licensure exams. In years prior, when we used a live patient for our exams, students were required to obtain, screen, and ensure their patients met the criteria for participating in the exam. SRTA recognized the difficulties surrounding and securing a patient and began transitioning into a Manikin-based portion of the clinical examination. Today, we can offer a full Manikin-based exam, eliminating the need for human subjects in the assessment. SRTA's Manikin-based exam uses the most advanced technology available, and our dental models are anatomically similar with the look and feel of real teeth and simulation of situations seen in the dental office. Now, let's review some specifics about SRTA's Manikin-based hygiene exam. Our examination evaluates the following skills for an entry-level dental hygienist: calculus detection, a periodontal pocket depth measurement exercise, and completing a partial oral prophylaxis. During the exam, candidates will screen a typodont for 12 surfaces of heavy to moderate calculus to meet the examination requirements. Once a candidate has determined which quadrant and any additional teeth meet the calculus qualifications, the case selection is entered into our scoring system. For clinical treatment, candidates will be assigned 2 teeth to measure periodontal pocket depths, 3 teeth for calculus detection, and a quadrant and any additional teeth to perform the scaling exercise. They will have 2 hours to complete clinical treatment. We will now walk through the schedule for an examination day. The exam day begins with general session and registration. The clinic floor manager and dental hygiene administrator will check ID cards, distribute SRTA badges, and collect paperwork. A reasonable number of questions will be taken.
The setup begins after registration. Candidates will have 60 minutes to prepare their cubicle, mount their typodont, screen and evaluate the typodont, and make their teeth selection.
Next is check-in. During this time, the examiners will evaluate the candidate's teeth selection, assign teeth for calculus detection, and periodontal assessment. Candidates are allowed 120 minutes for treatment time. For more detail into the clinical treatment portion of the exam, we instruct candidates to proceed with the following steps. First, measure and record periodontal pocket depths on the 2 teeth assigned. Second, complete the calculus detection exercise. And third, thoroughly clean all surfaces of the teeth in the final selection assigned. These high-tech mannequins mimic live patients and provide better control for the examiners. Let's watch 2 videos demonstrating a portion of the SRTA examination. In the first video, you will see how hand scaling is being utilized to remove the calculus on a typodont. The next video demonstrates removal with the use of an ultrasonic instrument. When utilizing an ultrasonic instrument, candidates must ensure that they have proper evacuation and collection for any water spray. Both these methods are permissible for use in the SRTA's examination. Here are a few of our frequently asked questions regarding SRTA's non-patient-based examination.
How much is the examination? The price of the hygiene exam can be found on the SRTA website at srta.org.
How long is treatment time? Candidates receive 2 hours, 120 minutes of clinical treatment time to measure periodontal pocket depths on 2 teeth, conduct a calculus detection exercise on 3 teeth, and a partial oral prophylaxis on 1 quadrant and any additional teeth from the case selection. What grade or score is passing? Candidates must earn 75 or more points to pass. Do we have to supply our own instruments? Yes. Candidates will need to provide the following: an 1112 Explorer, for example, an ODU or EXD 1112, a probe with 1 millimeter increment markings, and a mirror, which can be single or double-sided. Can I purchase a typodont to practice on? Yes. Candidates can purchase a dental hygiene typodont from Accidental, found at www.accidental.com. Does my typodont need to be mounted? Yes. You will mount the typodont on a mannequin pole in order to simulate as if a patient were being treated. Does the exam require polishing the teeth? No. Because these teeth are plastic, there is no need to polish them. Do I have to present x-rays? No. X-rays are not needed for the non-patient examination. Will my typodont have sufficient calculus to meet the requirements? Yes. All examination typodonts are standardized to meet calculus requirements. Does infection control still matter? Yes. Although this is a non-patient examination, candidates will follow standard infection control protocols as if treating a live patient. With the emergence of this pandemic, SRTA has been active and persistent in working with students and schools and state boards and the stakeholders to ensure a safe and effective method of assessing skills for licensure. SRTA remains a transparent service dedicated to the students and the future of the dental industry. We are proud to present to you our Manikin-based exam for your assessment. We offer practice examinations, mock boards, lunch and learn presentations, and pre-examination overviews at no cost for our dental and dental hygiene candidates. We invite you to apply for SRTA's safe, complete, non-patient-based dental hygiene exam. Contact us for questions or to schedule an exam at your school. We're here to help. Thank you for your time.